Today I'm going to talk about the 13-year loophole in Medicare. 13 years, yeah. That's how long Big Pharma can keep Medicare at bay. 13 years of unchecked pricing. 13 years of profits over patients. 13 years of financial strain on American families. But wait, there's more. Don't buy a pillow. What if we told you those 13 years could stretch indefinitely? Here's the trick. Pharma takes an old drug, one that's nearing its 13th birthday, which means we get to negotiate, and then we mix it with something new. Voila! Clock resets. It's not medicine, it's magic, but maybe it's manipulation. Big Pharma calls it innovation, patients call it exploitation, the rest of us call it what it is. A loophole. A very nice loophole paid for with lots of dollars. It's not about healing. This is about dealing. We're dealing in loopholes and we're dealing in technicalities. We're dealing in unrestrained profits with no competition. Medicare was supposed to negotiate, to bring prices down, to make medicines accessible, to give hope to those who can't afford it. Instead, we, the American people, got a game of regulatory cat and mouse. Instead, we got a game of big influence buying lawmakers. Nothing new. The rules say 13 years, but the game never ends. The mouse always finds a new hole. Who wins? Not you. Not patients struggling to afford their prescriptions. Not the taxpayer who has money extracted from their paychecks every 2 weeks. Not the healthcare system buckling under these unsustainable costs. Just the pharmacies companies. They're not breaking the law. They're bending it. They're twisting it, stretching it to a point where it's going to be broken forever. Is this what they meant by drug innovation? Creating new combinations not to heal but to avoid negotiation? That's not a cure. That's just another way to cash in. It's a numbers game. But the numbers that matter aren't on the balance sheet. They're in the homes of Americans, in the wallets of patients, in the life expectancies of those who cannot afford these valuable treatments. It's time to ask a serious question. What is the real price of this 13-year loophole? How many lives could we save if medicines were truly affordable? When did profits become more important than patients? How did we let a system designed to heal become a system designed to profit without any oversight? The defenders say, but what about research and development costs? All right, maybe that's a fair question. But when did R&D become a shield for greed? How does innovation become an excuse for exploitation? Yes, Americans need new drugs. We need new medical breakthroughs. But do we need them at any cost? There's a balance to be struck. That's fair between innovation and accessibility, between profit and public good, between the letter of the law and in the spirit of which it was written. Right now, that balance is off, and it's way off. What can we do? Well, you can write your lawmaker, we could close the loophole, we could rewrite the rules, we could rethink the system, which is what many thousands are working on. They aren't easy questions, but they are necessary ones, because while we debate, I educate, we deliberate, we delay, the clock is ticking. The clock is ticking. For whom? For the patients waiting for affordable medicines. For the families choosing between medication and food. The pharmaceutical companies are doing nothing but watching their profits grow. 13 years is a very long time. An eternity if you're sick and you can't afford treatment, but it's a blink of an eye if you're reaping in the profits. It's time to decide. Do the American people want a healthcare system or a wealth care system? Or a sick care system? Tick-tock. Tick-tock. Remember, the healthcare system wasn't built for patients or the real payer. You're the real payer, by the way. It was built for maximum extraction. You, the American person, has just become something where we can take money from. My name is Dutch Rojas. My mission is affordable, accessible care for everyone, everywhere. Hope you enjoyed it. Rojas out.